Today we are going to study about the temporomandibular joint. This is the conoid part of the temporomandibular joint, or it is the head part, and this is the neck part of the temporomandibular joint. We have cutted here because to see the infratemporal fossa, and another process here where this temporalis muscle is attached. This is coronoid process of mandible. The blood supply of this temporomandibular joint is by the branches from the superficial temporal artery and branches from the maxillary artery. This is the maxillary artery. The branches from the maxillary artery will supply the temporomandibular joint, and auriculotemporal nerve will also supply the temporomandibular joint. And the movements of this temporomandibular joint is, one is elevation of this jaw or mandible is done by three muscles. One is medial pterygoid, temporalis and masseter muscle. And the depression of this mandible is done by only single muscle, that is, this is the lateral pterygoid muscle, which depresses the mandible, only muscle. And the protraction of this mandible is done by the medial and lateral pterygoid, and retraction is done by the temporalis muscle. The overextension of this mandible will cause the anterior dislocation of this temporomandibular joint, and in the operation of this temporomandibular joint, the seventh nerve will be carefully preserved. Means seventh cranial nerve, that is facial nerve, which is running here, it from stylomastid foramen, will be carefully preserved here.